Welcome back to Golden Aging Health. Have you ever noticed your feet sending strange signals? Numbness, swelling, or cracked heels might seem like simple signs of aging, but they could be your body's quiet way of warning you about deeper health issues. Ignoring these signs could lead to significant problems in the future. In this video, we'll reveal 5 important foot signs you should never overlook. By paying attention early, you can protect your health and live your later years with strength and peace of mind. If staying healthy matters to you, hit like and subscribe, because we're always working to bring you the latest tips and insights to support your well-being. Let's get started with the first important sign your feet might be trying to tell you.
Morning foot and ankle swelling, a warning sign of heart, kidney, or liver dysfunction. Have you ever noticed that your feet feel perfectly fine at night, but by morning your ankles are tight, swollen, and uncomfortable, as if your slippers had suddenly shrunk overnight? This kind of swelling isn't always caused by standing too long or walking more than usual. In many cases, it can be an early indicator that something more serious is wrong, especially with your heart, kidneys, or liver. Swollen feet often reflect problems in 3 key organs. When the heart weakens, it struggles to pump blood efficiently. This causes blood to back up and pool in the lower legs and ankles. At the same time, if the kidneys aren't filtering properly, they fail to remove excess salt and water, leading to fluid buildup in the body. Liver issues also play a role. When liver function declines, it produces less albumin, a protein that normally keeps fluid within blood vessels. Without enough albumin, fluid leaks into surrounding tissues, particularly around the feet. Many people mistakenly attribute this swelling to just another part of aging. But persistent swelling, especially if it comes with fatigue, shortness of breath, or sudden weight gain, should never be ignored. These symptoms can signal serious underlying conditions that require medical attention. Delaying care could lead to further damage to your heart, kidneys, or liver. To ease mild swelling and support circulation, a few daily habits can help, such as reducing salt intake and eating more potassium-rich foods like bananas, avocados, and leafy greens helps your body regulate fluid balance more effectively. Staying hydrated, taking daily walks, and gently elevating your feet can improve blood flow. Some people also find relief by soaking their feet in warm water with ginger and Himalayan pink salt, which may reduce inflammation and encourage circulation. However, these are supportive steps, not substitutes for medical care. If swelling persists, worsens, or appears with other symptoms, it's important to consult a doctor promptly. Next, let's talk about a sign that's often overlooked but can hide serious health risks: the unusual changes in your toenails.
Thickened, discolored toenails, a warning sign of diabetes and immune system issues. Swollen feet and ankles may seem like minor discomfort, but medically, this condition, called peripheral edema, can be a sign of deeper issues with the heart, kidneys, or liver. According to the Mayo Clinic, heart problems such as congestive heart failure can weaken the heart's ability to pump blood efficiently, causing blood to pool in the legs and feet. This leads to visible swelling that often worsens over time. Similarly, if the kidneys are not filtering out excess salt and water properly, fluid builds up in the tissues. Liver diseases such as cirrhosis reduce the production of albumin, a protein that helps retain fluid within blood vessels. When albumin levels drop, fluid seeps into surrounding tissue, contributing further to swelling. If the swelling doesn't go down overnight or worsens after standing or walking, it's a clear red flag. Ignoring it can lead to skin breakdown, infection, or long-term organ damage. To help manage and reduce swelling in your feet and ankles, try incorporating these simple but effective daily habits. Reduce salt intake to help prevent fluid retention in the body. Stay well hydrated to support healthy kidney function and overall fluid balance. Engage in gentle daily movement, such as walking, to promote circulation and reduce fluid buildup in the lower legs. Elevate your feet while sitting or lying down to encourage fluid to return toward the heart. Soak your feet in warm water with ginger or Himalayan pink salt to improve blood flow and provide soothing relief. Always consult a healthcare professional if swelling persists, worsens, or appears alongside other symptoms. Recognizing these subtle changes in your toenails is crucial, but there's another foot-related warning sign that's even more urgent: non-healing foot ulcers. Let's dive into why these wounds occur and why they demand immediate attention.
Number 3. Slow healing foot ulcers, a warning sign of poor circulation and diabetes. Have you or a loved one ever had a small wound on the foot that just wouldn't heal? It may seem like nothing at first, but slow healing ulcers can be an early warning sign of diabetes or poor circulation, and they should never be ignored. If this has happened to you, share your story in the comments. It could help someone else stay alert. One of the main causes behind these stubborn wounds is peripheral neuropathy, a type of nerve damage often linked to diabetes. When you lose feeling in your feet, it's easy to miss small cuts or blisters. At the same time, poor blood flow limits the oxygen and nutrients needed for healing, leaving wounds vulnerable to infection. A 2019 study in diabetes care highlights the importance of stable blood sugar control in speeding up wound recovery and preventing complications. Monitoring HbA1c, eating a balanced diet, staying active, and following your treatment plan are all essential parts of long-term care. Just as important is daily foot inspection. Look for cuts, blisters, swelling, or redness. Keep your feet clean and moisturized, and always wear proper footwear to avoid injury. These simple habits can prevent small problems from turning serious. Be on the lookout for warning signs like pus, increasing redness, foul odor, swelling, or fever. These may point to a serious infection that requires urgent medical care. Delaying treatment could result in permanent tissue damage or even amputation. One inspiring story comes from a 2021 University of Michigan case study. A patient with recurring ulcers took quick action, seeking care early and managing their diabetes well. Thanks to that, they fully recovered and avoided life-changing consequences. Let their story be a reminder. Never brush off a wound on your foot. With early attention and proper care, you can protect both your health and your independence. This sign is easy to miss, but could be a crucial warning. Stay tuned to learn how to spot and handle it. Now, let's move on to the next important foot sign that many overlook.
Number 4. Itching, burning, or tingling feet, a warning sign of nerve damage and vitamin B12 deficiency. Itching, burning, and tingling sensations in the feet can be early signs of nerve dysfunction, not just skin irritation. These symptoms are commonly linked to peripheral neuropathy, a condition often caused by aging, diabetes, or underlying organ issues. One major cause, but often overlooked, is a vitamin B12 deficiency. B12 plays a crucial role in maintaining healthy nerve function. When levels drop, especially in older adults, nerves can misfire, creating sensations of numbness, burning, or prickling. A 2019 study published in Neurology showed that supplementing with vitamin B12 can significantly improve nerve health and reduce these uncomfortable symptoms. In people with diabetes, these signs may also indicate early-stage peripheral neuropathy. Unlike foot ulcers, which appear in later stages, nerve irritation often begins subtly with strange sensations in the feet. If left untreated, it can progress to pain, balance problems, or even mobility loss. Liver and kidney dysfunction can also contribute by allowing toxins to accumulate in the bloodstream. These toxins can damage nerve fibers and intensify the burning or itching feeling in the extremities. To support nerve health, in addition to managing blood sugar and correcting deficiencies, some people explore natural options like curcumin from turmeric and ginkgo biloba. These compounds have been studied for their anti-inflammatory and neuroprotective effects and may offer additional support when used alongside standard care. If symptoms persist or worsen, especially when paired with muscle weakness, difficulty walking, or loss of coordination, it is important to seek medical evaluation. A neurologist or endocrinologist can identify the root cause and recommend appropriate treatment.
5. Foot discoloration, a warning sign of circulatory problems and vascular disease. Changes in the color of your feet can reveal more than just a skin issue. When blood flow is compromised, the skin may appear bluish, dark red, or unusually pale. These shifts often reflect a lack of oxygen reaching the tissues due to poor circulation in the lower limbs. This condition may be linked to underlying issues such as heart disease, peripheral artery disease, or deep vein thrombosis. In some cases, people may also experience heaviness, coldness, or discomfort in the feet. These signs should never be ignored. One real-life example involved a 67-year-old man who noticed bluish discoloration and swelling after short walks. At first, he thought it was a normal part of aging. But as the symptoms worsened, he sought medical care and was diagnosed with deep vein thrombosis, a serious condition that can become life-threatening if untreated. The American Heart Association emphasizes that skin discoloration, swelling, warmth, or pain in the feet or legs should be taken seriously. These symptoms often indicate a vascular problem that needs timely diagnosis and care. To support circulation, engage in light daily movement, avoid sitting or standing for long periods, and have regular checkups to monitor your heart and blood vessels. Even subtle changes in your feet can be early signals that something more serious is happening in your body.
Swollen feet in the morning, yellow, thickened toenails, non-healing foot ulcers, burning, tingling sensations, unusual skin discoloration. Individually, these may seem like minor foot problems, but together they can be powerful warning signs your feet are revealing about your overall health. These symptoms may point to early signs of diabetes, heart disease, immune dysfunction, or issues with the liver and kidneys. Your feet are often the first place your body shows distress. That is why it is important to pay attention to what they are telling you. Early detection, regular checkups, and timely medical care can help prevent complications and support long-term health. If you notice any of these symptoms, especially if they include pain, warmth, discharge, or wounds that are slow to heal, speak with a healthcare professional. Taking care of your feet is a vital part of protecting your well-being. If this video helped you understand your body better, explore more content on our channel for practical advice on aging healthily. And if you found this content useful, please like this video and subscribe to stay up to date with our latest health tips.